Today we are going to discuss about Fowler's position. It is a standard patient position in which the patient is seated in a semi-sitting position. Fowler's position means it is a standard patient position in which the patient is seated in a semi-sitting position. Low Fowler's position. If the patient head is elevated in 15 to 30 degrees Celsius, this position is low Fowler's position. Semi-Fowler's position. Patient head is elevated in 30 to 45 degree. Semi-Fowler's position. In semi-Fowler's position, patient head is elevated in 30 to 45 degree. High Fowler's position. In high Fowler's position, patient head is elevated 60 to 90 degree. In low Fowler's position, patient head is elevated 15 to 30 degree. In semi-Fowler's position, patient head is elevated 30 to 45 degree. In high Fowler's position, the patient head is elevated 60 to 90 degree. Uses: promote lung expansion. Uses: promote lung expansion. In this position, gravity pulls the diaphragm downward, allowing greater chest and lung expansion, so good for breathing difficulty patients. This Fowler's position is good for breathing difficulty patient. Why means in sitting position, gravity pulls the diaphragm downwards, allowing greater chest and lung expansion. So it is good for breathing difficulty patient. Useful for NGT. It is useful for NGT patients. It is useful for respiratory, neurology and cardiac patients. This position prepare for walking. Before walking, we are placing the patient in Fowler's position and examine the patient for any giddiness. So it is the preparation for walking. It is useful in some surgery such as neuro or shoulder surgery. This position is useful in some surgery such as neuro or shoulder surgery. This position is useful for administering medications, and it is useful in preventing aspiration during tube feeding. This position is useful to prevent aspiration during tube feeding.